This weekly newsflash is sponsored by Partners Advantage Insurance Services. Experience the advantage of a true wholesale partner. For more information, visit partnersadvantage.com. The four largest U.S. insurance companies denied health coverage to 1 out of every 7 applicants based on their medical history, according to a congressional investigation released Tuesday. The investigation looked at Aetna Inc., Humana Inc., United Health Group Inc., and WellPoint Inc. between 2007 and 2009, and found that the number of people denied coverage increased by 49% over the 3-year period. More than 651,000 people were denied coverage, 212,800 of whom were denied coverage for pre-existing conditions. People with individual policies not covered through their employer or Medicare can be denied coverage for their medical history. Approximately 15.7 million adults under the age of 65 received health coverage through an individual policy in 2008. The insurance companies each had a list of pre-existing conditions that could be used to deny coverage, according to the report. One insurer listed 425 such conditions. Conditions on the lists included heart disease, diabetes, and pregnancy. A spokesman for America's Health Insurance Plans said that unless everyone is required to purchase coverage, insurers need the option to factor in an applicant's health record. Without the option, there are no measures to prevent people from purchasing coverage only after they become sick. The Patient Protection and Affordable Care Act includes a coverage mandate making it illegal for insurers to deny coverage based on pre-existing conditions. But those segments of the legislation will not go into effect for adults until 2014. Until then, a nationwide temporary program is in place to help those with past illnesses obtain coverage. In the weeks leading up to the midterm U.S. congressional elections, the report's findings are regarded as positive for Democrats who support the health bill. Caring for a loved one often takes a significant toll on retirement savings, according to a recent survey conducted by Genworth Financial. Genworth surveyed 818 U.S. adults who are either recipients of long-term care or had a family member that was a recipient of care for 30 days or longer during the previous year. The study divided respondents into 2 groups: primary caregivers, who were the main providers of hands-on care, and secondary caregivers, or those involved with care who do not provide day-to-day support. Of those surveyed, 73% of primary caregivers and 40% of secondary caregivers said they cut back their contributions to savings accounts due to caregiving responsibilities. 80% of primary caregivers said they reduced retirement contributions, and 55% of secondary caregivers reported doing so. 65% of primary caregivers and 22% of secondary caregivers also reported diminishing their 401k contributions. Approximately 44% of primary caregivers and 29% of secondary caregivers said they had to reduce their number of work hours as a result of caregiving requirements. 48% of primary caregivers and 42% of secondary caregivers said they lost jobs, changed shifts, or missed career opportunities due to their additional responsibilities. Six states were granted an award of more than $13 million to develop criminal background check programs for jobs at long-term care facilities. The funds, awarded by the Centers for Medicare and Medicaid Services, are to be used to combat abuse and improve long-term care patient safety. Alaska, Connecticut, Delaware, Florida, Missouri, and Rhode Island will each share a portion of the money. The National Background Check Program, a provision of the healthcare law, is intended to be used by LTC providers to determine whether a job seeker's history makes them unqualified to work directly with residents. The law designated $160 million for the program, and 11 more states may be approved for funding by November. Quote, "Elder abuse and neglect is tragic and intolerable," said Health and Human Services Secretary Kathleen Sebelius. Workers with a history of abuse or neglect should be identified and prevented from ever working with residents of these facilities, unquote. Advisors to the wealthy are warning their clients to prepare for rising taxes in 2011. The estate tax and generation skipping tax, which were eliminated for 2010, are expected to return at 55% with a $1 million exemption in 2011. Year-end taxes, income taxes, gift taxes, and dividend and capital gains taxes are all expected to rise unless Congress votes to extend the lower rates. Firms are advising their clients to prepare for increases as it doesn't appear Congress will act to halt them. Private bankers are counseling clients to pass money on to their grandchildren before January to take advantage of the lapsed generation skipping tax. In addition, they are recommending clients sell stocks with low cost bases before January in order to avoid the higher capital gains taxes expected in 2011. Many private banks report their clients are more hesitant about investing due to the uncertainty surrounding taxes. However, advisors recommend that clients not base their investment decisions solely on tax concerns, and that they should act now to take advantage of the current low tax rates before the year comes to an end. For more on the industry, visit producersweb.com.